For body planes, we have the sagittal plane. That divides the body into a left and right side. It's also called a median or mid-sagittal. You could have a parasagittal that would be still dividing the body into a left and right side, but just off-center. For a horizontal plane, known as the transverse plane, this divides the body into a superior or inferior section, and again, this can be done anywhere between the head and the toes. An oblique plane visualizes the body through imaging at an angle, so you can visualize organs at an angle as well. We also have the frontal plane, also called the coronal plane. It'll divide the body into a front and back, or anterior ventral, or dorsal posterior. Directional terms. Proximal is nearer to the attachment of a limb, the trunk, or a structure. Distal is farther from the point of the attachment. The head is superior to the sternum. The olecranon is distal to the acromion. The axilla is proximal to the brachial. The nose is medial to the eyes. The elbow is proximal to the carpus. The sternum is anterior to the vertebral column. The umbilicus is inferior to the sternum. The patella is proximal to the tarsus. And the ears are lateral to the nose. For the abdominal pelvic regions, it's divided into 4 quadrants. This is the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Another way of dividing the abdominal pelvic area is to put it into 9 regions. The first region here is the left hypochondriac region. That's going to have the small intestine, stomach, tip of the liver, and tail of the pancreas. Next we have the left lumbar region. That has the descending colon of the large intestine. It has the small intestine and the tip of the left kidney. The left inguinal region, also known as the iliac region, has initial part of the sigmoid colon, descending colon, and small intestine. The middle top part is the epigastric region. That has the stomach, liver, pancreas, and esophagus. Middle section is called the umbilical region. That has the transverse colon of the large intestine, the small intestine, and the pancreas. The hypogastric or pubic region has the urinary bladder, and in females has the uterus, in males has the prostate. And during pregnancy, the uterus will expand so that it actually will involve all 9 regions. Next we have the right hypochondriac region, and that has the liver, gallbladder, and right kidney. The right lumbar region has the ascending colon of the large intestine, small intestines, and the tip of the liver. The inguinal or iliac region has the cecum, appendix, small intestine, and the ascending colon.